My name is John Lee. I'm a 69-year-old entrepreneur. I work with lots of new and exciting companies, creating new products, new opportunities, and hopefully lots of wealth. Now we will talk about 3 new treatments that Dr. Simon Allen is introducing into the market. Please tell us about yourself and how long you have suffered from heart-related problems.
I am Galina Tikhomirova and I'm 89 years old. For over 45 years, I worked in the library in Moscow as a senior librarian, and I am also a veteran of World War II. I have many medals in recognition of this. Regarding my heart, I can say that for many years I suffered from high blood pressure, and on occasion, during the last 5 to 7 years, I experienced breathlessness and discomfort in my chest, which, as I was told, are symptoms of a heart problem.
What happened to you in January 2009 when you were taken to the John Radcliffe Hospital in Oxford?
I was with my daughter and her husband, Dr. Allen. We had come to Oxford to celebrate New Year with my granddaughter. They took me to a very pleasant restaurant on New Year's Eve, so I felt quite well and enjoyed the celebration. A couple of weeks later, I began to experience breathlessness and pain in my chest, so the ambulance was called, and it took me to the Radcliffe Hospital, where I stayed with my daughter in the emergency department. Various doctors discussed my condition and arranged for an intravenous drip with certain drugs to be administered.
What else happened to you that day? How did you feel during your few days in hospital and afterwards once you had been discharged?
I felt very weak. The next morning, my daughter told me that my heart function was very weak and that the doctors had given me adrenaline to support it. She was very worried because 5 doctors explained that my heart would fail if the adrenaline drip was stopped. She called her husband, Dr. Allen, who is a very highly qualified doctor, as she was sure that he could help. Dr. Allen arrived and put 2 small blocks on my heart area, one on the left side and the second on the front of my chest, and bandaged them tightly. He agreed with the hospital's doctors that they would reduce the adrenaline slowly over the next 7 or 8 hours.
Один с левой стороны, а другой прямо на грудь, и забинтовал их сверху плотно.
The nurses and doctors checked my condition during this time, but I remained alive and breathing. That evening, they confidentially transferred me from intensive care to the ward. Slowly, over the next 5 days, I became stronger. The pain in my heart had gone, and my daughter was then able to take me home once I was discharged from the care of the hospital.
Боли сердца прошли, меня выписали из госпиталя, и дочка привезла меня домой.
When did you start to wear Dr. Allen's device for the heart? Did you wear the thermoelements on your heart area only or also on the upper spine? How easy is it to use the device?
I have been a regular user of Dr. Allen's device for the heart since I was discharged from the Radcliffe Hospital over 2 years ago. It is very easy to use as the thermoelements are incorporated in a specially designed vest. This vest is made of soft cotton that is comfortable to wear. In addition, after I left the hospital, I also used the thermo elements against my upper spine. These are incorporated in the same vest and comfortably fit the contours of my body and do not impede free movement. Dr. Allen says that it is necessary to wear them to protect the vertebrae discs from shrinkage, as distortions of the spine may affect my breathing and heart function.
What are the doctor's recommendations now? Do you have any records of the progress of your heart condition?
The doctors see me regularly. I visit my GP and the cardiologist in Lewisham Hospital at least once every 6 months. All previous examinations have shown that my heart condition is stable. The doctors have prescribed some tablets that regulate my blood pressure, which I check daily. For the heart, I receive the treatment recommended by Dr. Allen. I like to spend my day by walking around the area I live in, as I think this is the best way of developing the progress of my heart and general condition.
What is your overall opinion about the natural treatment developed by Dr. Simon Allen? Is it a good choice for people who suffer with heart problems?
There is no doubt that Dr. Allen's device for the heart treatment works perfectly. I have enjoyed the last 2 years pain-free only because I wear the special vest he developed. I am 89 years old and am able to continue living an active life with my family. I discovered for myself the effectiveness of natural treatment as recommended by Dr. Simon Allen, and I am convinced that people getting older should wear the device he has invented to prevent heart problems developing.
Well, thank you very much for your time. It's been a very interesting discussion.